Hey guys, so my name is Reagan, and I chose to do my therapeutic interventions presentation on the effects of static stretching versus proprioceptive neuromuscular facilitation, which is also known as PNF stretching. And I'm going to be looking at how these two stretching techniques can affect hamstring flexibility. So, one of the most common forms of stretching is known as static stretching. And this is when you hold a certain stretch in a certain position for a specific period of time. And this is done without moving at all. So, the position is usually held for 30 seconds with multiple reps. And static stretching can be broken down into either active or passive stretching. Active static stretching is a type of stretching that you do all by yourself, as you can see with the picture on the top. And this means that the other muscle group, the one that's not being stretched, is engaged in order to hold that limb in the position in order to stretch the targeted muscle group. So, for example, when you're actively stretching your hamstrings, the quadriceps are activated in order to feel that stretch in your hamstrings. So the other form of static stretching is passive, and you can see that as an example on at the bottom picture. And when you're doing passive stretching, another person is actually holding the limb in the position that you need in order to feel that stretch. And so this actually allows for that antagonist muscle group to relax as well. So PNF stretching, which also is proprioceptive neuromuscular facilitation, is kind of a more advanced form of flexibility training. This type of stretching involves both stretching and contracting of the muscles that you're trying to target. So when you are doing PNF stretching, another person is usually needed in order to assist with it. The contract relax technique, hold relax technique, and then the slow reversal hold relax technique are some of the most common types of PNF stretching techniques. And so these techniques consist of different patterns of contracting and relaxing the agonist and then the antagonist muscle groups as well. In addition to the help from the clinician in order to achieve that optimal stretch. So the first article I decided to include in my evidence was a case study conducted by Sosbier and his colleagues. This case looked at the effects of the contract-relax PNF stretching technique compared to static stretching on hamstring flexibility. So the participants of this study consisted of two sedentary males, and both participants were assigned to each protocol. Participant A performed passive static stretching, while participant B performed the contract-relax PNF stretching. The participants then switched protocols for the second occasion, which occurred 24 hours later after the first. And so each stretching protocol consisted of a hamstring stretch, the tricep serrae stretch, quadricep stretch, and the low back stretch. And each stretch was completed 4 times. And so in between each stretch, there was also a 30-second rest period for both protocols. And so the static stretching protocol consisted of 4 30-second stretches to the point of discomfort, but not pain. And this was actually measured by the participants. And so the contract-relax PNF stretching procedures consisted of 3 stages. In the first stage, the participant was flexed to their target joint as far as possible, and this was held for 10 seconds. And then in the second stage, the participant performed a voluntary contraction with the stretched muscle against a force executed submaximally by the researcher for 5 seconds. And so following that 5-second voluntary contraction, each participant relaxed for 5 seconds, and then in the third stage, the researcher applied to the target muscle a stretch force at the newfound end range, and that new stretch end range was held for 15 seconds. So passive hip flexion was measured before and after each stretching protocol. And this was measured by having the participant complete a single leg raise and then measured the degree of hip flexion they were able to achieve. And so results from this study actually showed that hip flexion increased by 25.34% after the control relax PNF stretching. But hip flexion after static stretching increased 24.19%. And so Sobeys and his colleagues determined that neither technique was really superior to the other because the results were so close. And they determined that they were both equally as effective in increasing hamstring flexibility. So next, O'Hara and his colleagues conducted a randomized control trial to determine the effectiveness of PNF and static stretching on hamstring flexibility. The study consisted of 45 healthy university students, and they were randomly allocated to one of three groups. One group received static stretching, another group received PNF stretching, and the control group received no intervention. The effectiveness of the interventions were determined by measuring passive knee extension at baseline and then again after the interventions. And so the static stretching group underwent a stretch where the researchers passively flexed the hip to where a strong but most tolerable and discomfort stretch was felt. And then once they reached that point, the knee was extended by the researcher. And the stretch was held for 30 seconds. And so the individuals that were assigned to the PNF stretch group were instructed to contract their hamstrings by flexing the knee against resistance, which was held by the researcher. And this contraction was held for 6 seconds, and then the knee was passively extended into full extension, which would be the new endpoint after the contraction. And so the PNF and static stretch were both done for only one repetition, and then hamstring length was recorded immediately after. The results showed that both static stretching and PNF stretching produced an increase in hamstring flexibility, but the PNF technique produced a slightly greater increase in passive knee extension of 4.27 degrees compared to the static stretching technique. So the last article I decided to include was a randomized control trial which looked at how PNF, static stretching, and the Mulligan stretching technique affected hamstring flexibility. This article looked into 3 different stretching techniques, but I'm just going to be focusing on the difference between PNF technique and the static stretching technique. And so 40 students with bilateral hamstring tightness were enrolled in the study, and they were randomly divided into 4 groups. The first group received the typical static stretching intervention, Group 2 received the PNF technique, and Group 3 received the Mulligan traction straight leg raise technique. And then the 4th group was the control group, who received no intervention. And so each stretching intervention was performed once a day, 3 times a week for 4 weeks. And measurements of hip flexion during a passive single leg straight raise were taken before the intervention and then again at the 4-week follow-up. And this measurement was used to determine how effective these stretching techniques were. And so the static stretching group stood with one foot on the floor and then placed the other foot on an elevated surface. This group was instructed to keep their back straight but hinge forward at the hips until a slight to moderate discomfort was felt at the back of the thigh along the hamstrings. And so this was done for 10 reps, with each stretch being held for 30 seconds and then a 10-second rest period between each stretch. And so next was the PNF group, and they used the hold relax PNF technique, which consisted of an active single leg raise. And so the subjects performed a held contraction for 10 seconds and then relaxed, which is when the leg was passively flexed further to the new endpoint by the researcher. And so the results of this study showed an average increase of 4.7 degrees of hip flexion for the static stretching group, but 15.6 degrees was the average increase for the PNF technique. And so the study found that the hold relax PNF stretching technique was more effective in increasing hamstring flexibility compared to static stretching. And so this study also determined that PNF stretching was more beneficial than static stretching. So the good news is both static stretching and PNF stretching can be free. You're able to do either of these anywhere you'd like, anytime. And neither PNF stretching or static stretching requires any type of equipment or training. And so when doing PNF stretching without equipment, you would really need someone to assist you. But with static stretching, you're able to do it all by yourself and without any sort of equipment. Some people do like to use a stretch strap, which you can use that for both static and for PNF stretching, and a stretch strap can actually be found on Amazon for just $15.95. Static stretching and PNF stretching actually both use the same CPT codes, which is 97110. And this CPT code is described as therapeutic exercises to develop strength, endurance, range of motion, and flexibility, each for 15 minutes. And so for these interventions, the in-network price is $34, while the out-of-network price or the uninsured price is $71. And a typical insurance plan will actually pay about $153, which leaves the patient paying roughly $65 out of pocket for a 15-minute session of static stretching or PNF stretching. So I would actually recommend that static stretching should be used in a high school setting over PNF stretching. So for Nina, who is a 16-year-old track athlete with a second-degree hamstring strain, which occurred 10 days ago, is actually a great example as to why static stretching would be better in the high school setting. Nina has only one certified athletic trainer at her school who is responsible for treating 500 student athletes. As long as the athletic trainer can educate Nina, she is completely capable of stretching herself. The athletic trainer probably doesn't have a lot of time in order to perform PNF stretching on every single athlete, but teaching them how to use static stretching is going to provide almost equally as effective results as PNF stretching. So that's why I would recommend static stretching for high school over PNF. And so this is also similar to my recommendation for a collegiate setting as well. For example, Nathan, who is a D2 tennis player, who has a rotator cuff strain that he was diagnosed with 4 days ago, could also use static stretching by himself. In the collegiate setting, the athletic trainers are also very busy, and similar to the high school setting, they probably don't have time to use PNF stretching on every single athlete there is. Educating Nathan on static stretching for his shoulder gives him the ability to stretch himself whenever he needs to without the help of anyone else. And the good thing is those results are going to be just as effective as the PNF stretching. So, on the other hand, Bridget, who is a firefighter who sustained a tricep strain 5 days ago and has been referred to an outpatient sports medicine clinic, I would definitely recommend that she does PNF stretching versus static stretching. She's in an outpatient clinic, and because of this, the clinician is able to spend much more one-on-one time with the patient, unlike in the high school or collegiate setting. In addition, Bridget's going to have to pay for this treatment, or at least insurance is going to have to step in. And so I would recommend using PNF because the price is the exact same for static stretching, but the results are just slightly better. So there's actually really strong evidence to support the use of both static and PNF stretching to increase hamstring flexibility. These treatment options are cost-efficient treatments, and especially compared to the use of ultrasound or diathermy for treating range of motion or flexibility, PNF stretching and static stretching are very cost-efficient. In addition, tight hamstrings often lead to SI joint dysfunction and many other causes of back pain. So hamstring stretching can even help avoid future conditions that would require additional health care. Therefore, reimbursement of PNF stretching and static stretching should be highly considered. The evidence supports the effectiveness of both PNF stretching and static stretching for increasing hamstring flexibility. Athletic trainers are licensed healthcare providers who can effectively address range of motion and flexibility issues with PNF and static stretching techniques based on their current educational training. By providing this treatment, athletes and even the general population who athletic trainers treat can address mobility issues. These outcomes will result in better posture, more mobility, and even decrease the need for future health care.